As state and county health officials monitor 19 people for Ebola symptoms, quarantines and one nurse's defiance continue to make headlines. Mary DEVEREAUX, Assistant Director of UC San Diego's Research Ethics Program, joins me to talk about the controversy over how to balance the civil rights of people who have been exposed to Ebola while treating patients in Africa and protecting the public's health. Mary, Nurse Casey Hickox returned from Sierra Leone after treating Ebola patients there. She has displayed no symptoms. She's tested negative for Ebola. The state of Maine has gone beyond CDC guidelines and placed her under a 21-day quarantine. She's defied it. What ethical issues does this case raise?
Well, I think in this case we have a standard ethical issue and sort of political debate, which is about the extent of the state power or public health officials to ask individuals, or in some cases to mandate individuals, quarantine themselves or take other health monitoring measures in the interest of protecting public health. I think the challenge in this case is that this particular nurse, who has, after all, risked her own health, her life and well-being to care for others, she's been back, as far as I understand it now, at least a week. She's been monitored. She was quarantined for 3 days in New York, New Jersey. And now the state of Maine is going beyond the CDC guidelines and asking her to self-quarantine herself. I'm not in a position to estimate her medical condition, but from what I understand, she is, according to everything we know about Ebola, everything we know about infectious disease and how we contain infectious disease, she is of no risk to the public.
So Casey Hickox says that she feels like she's been treated like an animal since she returned from Africa. She was isolated in this hospital tent in New Jersey, and she says that she feels like she is, by defying the quarantine, she feels like she is fighting for the rights of other medical workers who will be returning from Africa in upcoming weeks. How do you balance those rights with public health?
Well, I think one of the things we have to separate is the difference between what we know scientifically and medically and what public fears are. I think the fears are real, and I think there are a couple of reasons for that. One is Ebola is a particularly nasty disease, and right now we do not have good measures for actually treating the disease. It's much less of a risk in developed countries like the United States than it is in West Africa, but nonetheless, this is not anything that any member of the public would like to see themselves exposed to or at risk from. On the other hand, she is one of the frontline workers in actually combating this this medical emergency that we're all facing. So in terms of her civil rights, I think she has a case to be made that in fact she was quarantined in particularly, I think, unpleasant ways. She was not treated with the kind of respect you would expect someone returning from West Africa, working with Doctors Without Borders or other medical missions. She is engaged in a fight that is meant to protect all of us. We're now in a global village, and as air travel and not just the internet sort of demonstrate, we're all connected one to the other. So I can certainly understand her response to the way in which she's been treated.
So when you have states, though, who have gone beyond the CDC rules, how much of this is science-based versus panicky politicians?
Well, I think from everything I understand, I think there is a very strong element of panic here. There's been a lot written in the newspaper about the perception of these kinds of infectious diseases. It parallels everything we know from scary movies, science fiction, and so on. This organism originates someplace in the body. It comes from someplace far away. It infects all of us. So I do think that there's a large measure of fear that people are not perhaps completely comfortable with or trusting
I want
the
to build
official
on. I want to build on that
explanation.
very quickly. Thomas Duncan was the first patient to die here in Texas from Ebola. He's been cast as the guy who brought Ebola to America. We had the former executive director of the GOP in South Carolina saying that people with Ebola should be put down humanely. We've had calls for people, incoming travelers to the United States, being tested for Ebola in the same way that people are screened for terrorism. Is there an element of Typhoid Mary here?
Yes, I think that's a hysterical response. I also think it's a response that contradicts every ethical principle of both sort of medical treatment and of anything we know about international health crises. Ebola is not easily transmitted, and the idea that someone would talk about a human being who came to the United States, who felt ill, who brought himself forward to a hospital and was sent home as if he's an animal that should be put down, I think that goes beyond anything that I would hope that most citizens would endorse.
We've got to wrap it there. Mary DEVEREAUX, thanks so much for coming on the program.
Thank you.